If we've directed you to view this section of the DVD, it's because we've decided that the removal and replacement of the natural lens inside your eye is a better option than to operate on the cornea. First, please review the section on LASIK and the section on the phakic intraocular lens, because the limitations, the realistic expectations, as well as the side effects and the risks and complications of LASIK and the phakic intraocular lens are very similar to the refractive lens exchange procedure that we'll be talking about now. Now, the goal of this procedure is to reduce your dependence on glasses and contact lenses. It's important to realize that, again, this is a surgical procedure that it's not perfect. So even after we remove the lens inside your eye and replace it with an implant, the results will be close but not perfect to what we want to achieve. So everyone going into this procedure must understand that in order to fine-tune the vision to achieve our visual goals, probability is that we will need to perform a LASIK on one or both eyes in order to adjust the vision exactly to where we want it to be. And that's the same as LASIK or the phakic intraocular lens. Now, the procedure is done at our ambulatory surgery center using our dedicated implant surgery team and an anesthesiologist. You're awake during the procedure but relaxed, and we perform the procedure under local anesthesia. And it's the same as a cataract operation. We essentially remove the natural lens of your eye and replace it with what's called an intraocular lens implant. That is a lens that goes inside your eye in the position where the natural lens of your eye was removed. Now, obviously, this is an elective procedure, and any elective procedure must be weighed against the alternatives. And clearly, the safest alternative is to use glasses or contact lenses. But if you elect to have surgery, then surgery on your cornea, either using LASIK or one of the advanced surface procedures, will probably not achieve our goal. And that's why we've directed you to this section of the DVD. Now, we have implant choices. And the choices are a little confusing, and I'd like to go through them with you now. And then we'll certainly have plenty of time to talk about them between us to decide which is the best for you. Because it depends on many factors. Which implant choices we choose depends on your lifestyle, your occupation, your visual needs with respect to whether you need better vision at intermediate, say for computers, or better reading vision for books or close-up work. It depends on the type of sports you're interested in. It depends on many factors with respect to your lifestyle. There's no 100% perfect choice, but we can come pretty close with the choices, and again, as I said before, fine-tune it with a LASIK after the procedure. So here's a brief overview of the choices. First of all, we can make both eyes for full distance, in which case, for computers or reading, you need to wear glasses for those intermediate and near tasks. Alternatively, we can do what's called monovision. That is, we can do one eye for the full distance and the other eye for near. And that works pretty well, although some people don't like it, and that may not sound good to you. In that case, we have another option, which is to place what's called a multifocal lens inside the eye. Now, with respect to the multifocal lenses, we have a couple choices there too. Now, all the multifocal lenses are very good for the distance, but some are better for intermediate as well as distance, and some are better for near as well as distance. And again, depending on your lifestyle and your individual needs, we'll tailor the implant according to your needs. And again, a LASIK fine-tuning following the surgery may be necessary to achieve our goals. Let's discuss the side effects as well as the risks and complications of the clear lens extraction or the refractive lens exchange procedure. I like to categorize them in terms of intraoperative complications, that is, those that can occur during the operation, and post-operative complications, that is, those that can occur after the surgery. Now, in order to fully understand the risks and complications, let me explain a little bit more about the procedure. When we remove the lens of the eye, we purposely leave in little part of the natural lens of the eye. It's called the posterior capsule. And we do that for regular cataract surgery too. That posterior capsule serves to support the lens implant that we place inside the eye. It's a very, very, very thin membrane. And sometimes, during the course of the operation, the membrane tears a little bit, and we can't keep that membrane intact. Now, if that occurs, sometimes a little part of the jelly inside the eye comes forward, and we have to clean that up. That's called a vitrectomy operation. And we do that right at the time of the tear of the posterior capsule. Now sometimes, and this is rare, but it can occur, a little piece of the lens of your eye can fall back through the little tear in the capsule in toward the back of the eye, and that requires a little bit more extensive vitrectomy, and you need to go to a special vitrectomy specialist to do that, because I don't do that type of surgery. So it may require another surgery operation from another specialist. This is very rare, but I want you to know about the possibility. Now again, if this tear occurs in the posterior capsule, we may not be able to implant the implant that we've chosen. So for example, if we've chosen a certain type of a multifocal implant, either the one that goes distance and intermediate or the one for distance and near, if there's a tear in the posterior capsule, we won't be able to implant that lens, and we may have to implant a regular full distance lens. Now in some very rare cases, we may not be able to implant any lens at all, and in order to achieve your full vision, you may need to wear a contact lens in order to get your very best vision. Now, generally we perform the refractive lens exchange procedure in patients who are highly farsighted. And in those eyes tend to actually be physically smaller eyes. And a physically smaller eye has an increased risk of significant bleeding during the operation. Again, very rare, but when it occurs, it can be serious and actually can result in loss of the eye. Now, what about post-operative complications? Well, as I mentioned before, one of the most common post-operative complications is that the implant power that we select and we measure for isn't perfect, isn't right on. And in those cases, a LASIK procedure would need to be done to fine-tune the vision to achieve our visual goals. But still, in certain cases, glasses may be necessary or contact lenses to achieve your best vision for certain tasks. Now, additionally, there can be swelling of the retina in the back of the eye, which usually clears up within 6 to 12 months, but in rare cases, persists and results in vision that is better than it is now, but it's not crisp. It's a little cloudy as a result of the permanent swelling. Again, this is very rare. Or it can result in swelling of the cornea, that is the clear window of your eye, such that in a very rare case, a corneal transplant operation would be necessary in order to restore good vision. A retinal detachment can occur. That is when the retina, which is like the film in the back of the camera, peels off the back of the eye, and that again needs to be repaired by a retina specialist, generally resulting in excellent vision, but if a retinal detachment is severe, it can result in permanently poor vision after this type of surgery. Additionally, infection can be introduced at the time of surgery or may seep into the eye in the early post-operative period, such that if the infection gets inside the eye and is fairly severe and drops can't actually soak in, then it may result in the loss of an eye. Now, I'm happy to say, in over 10,000 cataract operations that I've performed with my surgical team in my federally certified and state licensed ambulatory surgery center, I've had no severe complications. In 10,000 cases, there have been a few cases of retinal detachment, but all of those cases have been able to be repaired and resulting in good vision. I've had a few cases of infection inside the eye, but none so severe that resulted in loss of the eye at all. So in general, although these cases can have complications, they're generally mild when they occur, and if they occur, they generally do not result in significant loss of vision, or certainly in loss of the eye. I know this is a lot of information to absorb in a short period of time, and I know that there are a lot of confusing implant choices. And I know that there's some potentially frightening risks and complications. Don't worry. Write down your questions and concerns. Write down and think about your visual needs, and we'll talk about it in the office, and we'll come to a decision as to the right implant for your needs. Now, with respect to the risks and complications, they can and do occur, but it's good to know that they are very, very rare. Although I cannot guarantee you a perfect risk-free surgical result, I can say that I've performed over 10,000 cataract surgeries and refractive lens exchange procedures along with my dedicated surgical team in my federally certified and state-licensed ambulatory surgery center. My complication rate is very, very low. And when complications occur, they tend to be mild, and certainly in my experience, I've had no cases of loss of the eye from a severe complication.